Good afternoon, ladies and gentlemen, and welcome to this maiden UN in Ghana Youth Impact Series. Moving on to the next speaker, who is Ms. Aya Chebi. She is the African Union Youth Envoy, the first ever African Youth Special Envoy on Youth, and the youngest diplomat, and I'm proud to say, at the African Union Commission Chairperson's Cabinet. Ms. Chebi, please, the floor is yours.
Thank you very much. Hello, everyone. I want to first thank you again for the invitation and congratulations on the launch of this series. I want to thank particularly Ms. Lopez, the UN Resident Coordinator in Ghana, Mr. Ojalapi, the UNFPA Resident Representative, Mr. Tete, the CEO of National Youth Authority, and every young person who contributed to making this reality. It's a pleasure to be here, and I will share a bit what we've been doing at the African Union and what I think the challenges for young people are, as I was asked to also share some of the challenges. And maybe just to provide the latest stats on today's morning from Africa CDC for what's happening in Africa. We have more than 51,000 cases so far on the continent. We have over 2,000 deaths and over 17,000 recoveries. But unfortunately, this data is not segregated by age in Africa, and there is some data segregated by gender, but I think we still can do much better on data and even the collection of data, because these numbers might not really reflect the actual cases, because we also still trying to expand on the testing and tracing. So in terms of challenges, I think there are many, and young people have been really impacted by the pandemic, but I will mention just 4 coming out of conversations we've been having with youth the past few weeks. The first one is the intersectionality of issues of young people, because people think youth have 1, 2, 3 challenges, and if we fix them, then we're addressing it. But young people are saying that COVID-19 doesn't really stop the peace building work that they need to do. COVID-19 doesn't stop the co-infection of other diseases like malaria and HIV. COVID-19 doesn't stop the Ebola, which we had the outbreak for a couple of years, and we still are dealing with Ebola. It doesn't also stop the plight of refugees, IDPs, youth with disability. It actually worsened these situations. So some young people would say, we may die of hunger or malnutrition and not COVID-19, or it's the same for me to die in the Mediterranean or to join a violent extremist group or to die with coronavirus, because I do not enjoy anyway basic human rights as a young person. So this is just to say that the complexity in Africa in handling the pandemic is in the existing issues that we are struggling with and we are dealing with, the weak infrastructure that we have, and other issues of inequality and development and layers of marginalization that young people go through. So this is not just a health crisis for us, it's a governance crisis. And youth before the pandemic were on the streets challenging the status quo and protesting governance and asking and demanding for reforms for the last decade. So it doesn't really help African youth when all the resources are, especially with donors, are redirected towards COVID-19 in one linear way, without tackling the existing issues, without continuing to support the work that has been done for years by youth, especially led organization. So from this first challenge, I think we just need to continue to support Africa's infrastructure as key for post-pandemic transformation. The second challenge is youth unemployment and informal sector. There is no young person on the continent who would not mention youth unemployment. Before the pandemic, the share of unemployed youth among the total unemployed was as high as 60% in some countries. African economies generate only 3 million formal jobs annually for an estimated 12 million youth entering the workforce every year. And this is before coronavirus outbreak. So African youth remain in the informal sector, which means during these lockdowns and homestays, they hustle and survive on insecure jobs. And now that does not exist, so they are unemployed. So the socioeconomic impact is enormous. And it needs a lot of attention, not only to analyze it, but really to provide concrete solutions. Because all the subsidies that I'm seeing put in place and measures by governments, whether regional or national, are not favoring informal sector. And yet approximately 60% of jobs in Africa are considered vulnerable. So many youth cannot even bear the minimum wage to be tax compliant. And we need packages that look at youth in informal sector and micro enterprises and move us from this economic empowerment narrative to really economic resilience, where our youth are and how can we make that resilient instead of trying to bring them to the formal sector. So a lot of things can happen in that direction: provision of capital, digitalization of the market, educating on e-marketing, on different skills that is needed to cope with the current circumstances. The third, I would say, a big challenge is for young women. Gender-based violence, for example, is very much linked to economic impact. So we cannot control GBV if young women are not economically empowered, because this makes them vulnerable to power dynamics. They're offered food or care only to abuse them, and women are being forced to be in lockdown with their abusers with no access to assistance and legal protection, especially because the laws and policies that we have on protecting women and girls do not apply to lockdown. This is a new reality. We see increase in child marriage. We see women organizations, especially young women organizations on the front line, who used to offer psychological and social assistance, are overwhelmed with work. They lack capacity, they lack funding, they lack shelters and facilities to make their work possible to do it. And then the issue of access to contraceptive, access to sanitary pads, the pre-existing conditions of HIV/AIDS are now people with pre-existing condition cannot access the ARVs, and young women and girls with disability and refugee and IDP also are struggling. So I think we just should not, again, this is a pre-pandemic are issues, but now they're becoming even more vulnerable in this circumstances and situation, and let alone the women and young women and girls in conflict situations like Libya, who have no assistance so far and no attention to their needs. The fourth and last challenge, I would say, is the digital divide. We know that 70% of Africa's population is offline. More than 40% of the world population is offline. So when people say education is disrupted, go and have education online, we're like, in Africa, how does that even possible when you do not have internet, or if you do, it's extremely expensive. And so I think we need to close the digital divide. We've been calling for this for decades, and for the responsibility of private sector especially, and of government to facilitate that. But I think this is the time that shows only those who are online are privileged to have access to this kind of platforms, or to training, or to opportunities. But the others who are not, who are out of the digital revolution, their education is disrupted and communication is disrupted. So I think the call to action from this challenge is to expand the supply chains and to support people who do not have access to technology, and align technology with the social impact. Now I'll move quickly, I hope I'm on time, but I'll move quickly to the focus on youth and what we're trying to do at the African Union to provide spaces, like Ms. Lopez said in her opening remarks. So we're trying to really build platforms and opportunities. Is crucial for us at the African Union to focus on youth. So we launched a couple of initiatives the last few weeks, focusing on 3 phases of the pandemic. The first phase is the preventive phase. So we've been convening since 23rd of March, the virtual AU Youth Consultation Series on COVID-19 for a collective youth response with Africa CDC. And for those who don't know, Africa CDC is the leading institution on the pandemic at the African Union that was established since 2017 and has been dealing with Ebola outbreak, and now is leading continental efforts on coronavirus outbreak. So these consultations are a series of online discussions. We completed the 12th round, so we convened 300 youth leaders from 40 countries. It's intimate conversation, so each group will have 20 to 25 activists, feminists, young leaders who set the tone for the youth perspective on the pandemic and discuss economic, social, and mental challenges. And now young people are actually self-organizing and hosting these consultations in different languages with our support. So I'm really excited to see that happening and to see it become a movement of youth who are self-organized. We also turn these consultations to public webinars with decision makers to empower youth with information and bring them closer to interact with decision makers, which was their demand. So we were only just responding to what they're asking us to do, to be that bridge. So we hosted the Africa CDC director, we hosted Commissioner of Social Affairs yesterday, we did a session in Arabic, we hosted the chairperson of the African Commission on Human Rights because we had so much demand on how are human rights respected in our countries and why we have all these violations. And then the second phase is the responsive phase. So we launched yesterday with Commissioner of Social Affairs and Commissioner of HRST in collaboration with Africa CDC, what we call the African Youth Front on Coronavirus, which is a multi-stakeholder advocacy group of youth networks that will engage in decision-making and really give a seat at the table. You know, I heard Ms. Lopez talking about tokenism and ticking boxes, so we want to move away from that and really have youth-led solution at the heart of supporting the implementation of the continental joint strategy, reporting directly to the Africa Task Force of Ministers and to Africa CDC. This will make actually the African Union the first intergovernmental institution in the world to create a high-level policy and advocacy framework for youth to co-lead the response on the pandemic. So I really call on all the youth following us from Ghana and all over Africa to get engaged with us on this continental mobilization and continue to show Africa's leadership despite skepticism of the world that Africa is unable to handle COVID-19 and always in need of foreign assistance, you know, but Africa needs solidarity. And I think this is the time for the world to learn from Africa because we are showing that kind of leadership. And then the last phase is the post-coronavirus transformation. So on that phase, we launched 2 initiatives. One is called the African Youth Charter Hustlers. We know that we have one of the most progressive documents on youth in Africa, the African Youth Charter, adopted in 2006. And now we're just trying to create or put youth at the center of post-COVID needs and reform of service delivery, including improvement of health infrastructure and dealing with other pandemics, because this is not the first and won't be the last, but we need to manage these pandemics better. And so this initiative will provide an opportunity for youth-led advocacy and youth-led accountability. We closed the deadline just last week, and we will select 2 youth from each country to be trained in advocacy to hold their governments accountable and to participate in the transformation of governance and African institutions. And then the last one I'll mention here is the African Youth in Public Service project, advocating for more youth in public service. We see that from this pandemic, the exclusion of youth from decision-making, we see it now happening when national authorities are not engaging young scientists, young health workers, young tech gurus, which we see the need for them now, especially with the need of digitalization. And so we think that promoting more and putting youth central to be in public service, attracting more youth in public service is important. So we hosted, beginning of this week, Monday and Tuesday, a workshop building community of peer learning and best practices, and brought together the youngest ministers on the continent and policymakers and parliamentarians to really attract more youth into politics, basically. And we know that this should address also the generation gap, because the average age of African leadership is 64 and the average age of the continent is 20. And so we have an absurd generation gap of 40 years, which is a gap in understanding the problem and dealing with it. So I also would like, through this initiative, to call on youth to get more engaged in public service and in politics, in government, in local councils. We need to occupy these spaces to be able to reform these institutions to work for us when these kind of crises happen. So I hope all these platforms are unifying and supporting African youth. We're trying to play our part and ensure that no one is left behind, especially the most vulnerable. And I would just say that we just need to do that, to play our part and work together and unify and mobilize. We have the power of demography, we have the innovation, creativity. We're the coolest generation. I don't see why we are not the ones on the front line leading the solution. But I think in this critical time, we need to join hands, especially with our leaders and governments, and co-lead with them and guide them on how to do things, how to communicate to our constituency, and how to make sure that we get out of this stronger. So we are the ones to save our continent. That would be my message to my peers in this call. And thank you very much.
Thank you, Aya, for that speech. And it's been very energetic, and I felt the power in there. And we are grateful that the AU is taking action. And the three initiatives that you mentioned, it creates that space that Sylvia did mention, to create the space needed for the youth to participate fully.